Hello everyone. Welcome to the Dr.Vet channel. Come to the livestock world. In this broadcast, let's find out about milk fever in cows. Milk fever is a disease related to metabolism in dairy cows during the reproductive stage, especially high-yielding dairy cows from the third calving onwards. Milk fever often occurs suddenly before and after birth, within 3 days, especially 1 to 2 days after birth. The cause of milk fever is a lack of calcium in the blood, also known as hypocalcemia. At the end of the dry period, dairy cows must suddenly change their metabolic activity, switching from the resting phase to the milk production phase. During the dry period, cows have relatively low calcium needs. When lactation begins, the need for calcium suddenly nearly doubles because a large amount of calcium is needed to produce colostrum, 2.3 grams per liter. Because most of the calcium in cows is transferred into milk, the calcium content in the blood drops sharply. Calcium is usually provided from food or mobilized from bones. When the calcium supply from bones and food is insufficient, the body will take the missing calcium from the muscles. This eventually leads to symptoms of paralysis and overstimulation of the nervous system. Therefore, the disease occurs as a result of the loss of the ability to regulate and maintain blood calcium levels through intestinal calcium absorption and calcium mobilization from bones in early lactation. After giving birth, the synthesis of colostrum and regular milk in cows increases, but the amount of dry matter ingested decreases sharply. As a result, the cow enters the hypocalcemia stage. Therefore, calcium balance is influenced by 3 main factors. Firstly, the loss of too much calcium in colostrum exceeds the ability to absorb it from the intestines and mobilize it from the bones to replace it. Secondly, it is due to impaired absorption of calcium from the intestines during calving. Finally, insufficient mobilization of calcium reserves from the bones is the result of hypoparathyroidism during the dry period. When a sick cow usually has a calcium concentration in blood of less than 75 milligrams per L, the cow breathes heavily and drools a lot due to hypocalcemia. The disease can be diagnosed through clinical symptoms. In stage 1, cows show initial signs such as sick cows have poor appetite or stop eating and may be irritated, stressed, or weak. Body temperature ranges from 38.6 to 38.8 degrees Celsius. In stage 2, the cow lying on its side, they show signs of moderate to severe depression, partial paralysis, and often lie with their heads turned to their sides. Abnormal body temperature from 36.7 to 37.8 degrees Celsius, dry muzzle, and increased heart rate. Cows breathe heavily and drool. In stage 3, the cow is hypocalcemia and completely paralyzed, often feels flatulent, lies on one side, and gradually loses consciousness, leading to coma. The temperature drops significantly and can drop to 35.6 to 37.8 degrees Celsius, and the heart rate increases. Cows will die quickly if not treated promptly. However, to make an accurate diagnosis, determining calcium levels in blood is the most accurate method. When a cow gets milk fever, it should be treated as soon as possible. Treatment can be carried out by giving cows intracheal pea drench, or inject Cancimag subcutaneously or intramuscularly to cows with mild cases that can still stand. However, injecting calcium under the skin can cause tissue necrosis, so avoid injecting too much at one point. As for severely paralyzed ones, it is necessary to conduct A slow intravenous infusion with products such as Cansamag from VB Pharma or Calmasol for 140 from the Netherlands, according to the manufacturer's recommended dose to achieve recovery fastest. When cows have milk fever, it will lead to reduced milk production, increased mortality, and increased veterinary treatment costs for sick cows. Therefore, disease prevention needs to be emphasized. Farmers prevent diseases in cows by: for cages, it is necessary to keep the cage dry, clean, with enough sunlight, and avoid wet and slippery floors. Avoid being malnourished or overweight in the prenatal period, and supplement high levels of calcium in the diet during the milking period. Avoid calcium supplementation during the dry period. Feed cows low-calcium diets during the dry period. Supplement vitamin D3 for cows. Vitamin D3 is essential for calcium homeostasis. Therefore, there have been many studies using vitamin D3 to prevent and treat milk fever or hypocalcemia in postpartum dairy cows. Supplement high-calcium diets after calving by intramuscular or subcutaneous injection of calcimag, helping cows increase milk yield and increase future reproductive output. According to researchers, injecting to calcium shots under the skin within the first 18 hours after birth also helps them to be less likely to suffer from metritis, endometritis, and hypocalcemia than cows that are not injected. Or give cows entracheal pea drench a day before and a day after calving. Recently, the channel Dr.Vet, Come to the Livestock World, has introduced about milk fever in dairy cows. We hope to bring a lot of useful information. We wish you success in farming. Goodbye and see you again.